Hello, everyone. Today we have the pleasure of speaking to Dr. Mielniczuk. Dr. Mielniczuk, thank you very much for being with us today. Why don't you tell everyone a little bit about who you are and what you do?
Hi, everyone. Nice to be here today. My name is Dr. Lisa Mielniczuk. I am a cardiologist at the Ottawa Heart Institute. I'm the director of the Advanced Heart Failure Program here in Ottawa.
Wonderful. And I understand that you've developed some protocols that you've been using within your hospital and some of the other hospitals around the Ottawa area. Can you tell us a little bit about these?
That's correct. With all of the new information and therapies on the pipeline for heart failure treatment, we've looked at different ways to try to optimize the care of our heart failure patients, specifically at that point where inpatients are being considered for discharge. We've developed a transition care program, which really focuses on two main objectives. The first is to ensure that patients are on best practice medicines before discharge, or at least best practice medicines have been considered prior to discharge. And the second is to ensure an adequate transitional plan. And what I mean by that is it's really a risk-based program where easily clinicians looking after these patients can identify the risk of the patient, and then we provide with them a platform of options to help support their transitional care once they get discharged.
Is this integrated within your electronic healthcare system? Is this done manually? And can you describe the protocol system in more detail?
Absolutely. So unfortunately, it's not yet integrated in our EHR. However, as you would imagine, that I think is a very important component that we are looking into down the road to facilitate ease of use. Essentially, there are two phases of the program. In the first phase, we remind clinicians of appropriate medical therapies for treatment specifically of HFrEF patients. So we introduce the concept of ensuring patients are on best practice medicines, considering switches to medications when appropriate, or additional therapies when appropriate and clinically indicated. And then the second phase of the program is to offer opportunities for these therapies to continue to be titrated once patients are discharged through the context of our home monitoring program, which essentially is a remote monitoring platform that we have here in Ottawa, which allows patients to be virtually followed with respect to blood pressure and heart rate, nursing interventions, so that these medications can continue to be titrated. And then the final component is identifying the highest risk patients for referral to an advanced heart failure clinic specifically at the Ottawa Heart Institute, and helping to distinguish those perhaps less acute patients who could be followed in one of our regional heart failure programs or followed safely by either their family physician or internal medicine specialist.
And with this program, have you noticed an increase in the use of evidence-based medications and therapies amongst your HFrEF patients?
We've certainly noticed at this point an increased awareness. There's still, I think, treatment gaps with respect to the safety of initiation of some of these therapies in hospital. And so we've done a lot of work at communicating with our partners and collaborators about the safety and efficacy of these options. Some of these therapies are still limited by hospital use formulary. And so there are still some hurdles or gaps that we need to achieve, but we certainly have noticed an increase in awareness and interest, and we've had positive feedback.
Wonderful. And what are some of the barriers that you've noted in implementing a program like this?
I think the biggest barrier we've already alluded to. The first is, I think for a program to truly be successful, you really need to integrate it in the real-time clinical decision-making. So having it in the EHR, I think, is essential, and that's not an easy task. You have to have the drugs available on formulary. So if you don't have them available on formulary, that also becomes challenging. And there has to be buy-in from the frontline users. So the frontline clinician health team have to believe that this is a strategy that's effective and safe. And so doing a lot of work, consulting, and meetings with your frontline workers to get their comfort in the program is also essential.
Wonderful. And if people want to find out more about this program, is there anywhere that they can go to, or a website or some publications they can refer to at this point?
At this point, not yet, no, but it is something that as we roll out, we likely would be posting on our Heart Institute website, but I couldn't point someone to it right now.
Wonderful. Well, thank you so much for your time. We really appreciate your expertise and your comments on this very important matter.
My pleasure. Thank you.